Halo saudara, saat ini Liputan 6 SCTV memiliki kesempatan untuk berbincang langsung dengan salah satu dokter neurologis dan juga movement disorder specialist dari London yang sudah bersama saya pada hari ini di studio, Dr. Vinod Mehta. Hai Dr. Vinod, how are you?
Fine, thanks very much for inviting me today. Thank you.
Yes, and thank you so much for joining us here.
Privilege and pleasure to be here.
Thank you so much for your time. So, first of all, we'd like to know about Parkinson, about the dementia, right? I heard that this disease is incurable. How about it?
See, let me tell you one thing. Do you heard of diabetes? You know what is diabetes? God gave us main 5 organs in the body. One organ called thyroid gland that produces a hormone called thyroxine. If you don't produce thyroxine, that's thyroid problems. Pancreas produce insulin. If it doesn't produce insulin, that is diabetes. Same thing, brain is just like an organ, like a liver, pancreas. It produces a hormone neurotransmitter called dopamine. If it doesn't produce dopamine, that is Parkinson's disease.
I see. So, is it categorized as incurable?
See, there is no word called cure for many of the conditions. So, like diabetes, there is no cure for diabetes.
You're right.
There is no cure for high blood pressure. So, Parkinson's disease is like diabetes and high blood pressure. If, I'm again saying, if diagnosed early, it is a very treatable condition. Cure, we are trying to look for it. So, we can find a cure if we find the cause of Parkinson's. So we are actually looking into the cause, like genetics. There are certain patients who have genetic cause of Parkinson's. So gene-targeted therapies are the ones to way forward to find a cure. For at the moment, we have excellent treatment options to stop progression of the disease.
Okay, but before that, can you explain more about the difference between Parkinson and movement disorder?
Right. See, movement disorder, if you see that movement, say for example, if there is no movement in the body, say if your movement becomes stiff and it doesn't move, that is what we call as hypokinetic. That means no dopamine in the brain. If you give too much of dopamine and the body will shake too much, that is the side effects of dopamine is too much of movement. So the balancing the dopamine is the art of treating Parkinson's disease.
All right. So, what kind of medication or treatment that you provide to relieve the symptoms? So we only can relieve the symptoms, right?
Right. See, if you look at last 20 years, the way we treat Parkinson's is changed. But unfortunately, in some certain countries where we don't have this novel therapies, say for example, there are oral options, patch options, like we can give dopamine through a patch, we can give dopamine through skin, we can give dopamine through a small tube in the brain, in the stomach. But if the idea is how quickly the dopamine goes to the brain. I came from airport here, I stuck up in Jakarta traffic. Say for example, if I stuck up in Jakarta traffic for 40 minutes, if the dopamine, the stomach is like a traffic jam. If you give dopamine through the oral, if it gets stuck up in the stomach, it doesn't go to the brain, then you don't get proper effect of the medicine. And the dopamine only stays for 3 hours. So what I'm seeing the prescriptions here is that we need to give the dopamine quickly on time to the brain.
All right. So is that one kind of the breakthrough you've done? Because we've heard about a very great testimony about you.
Yeah. See, it's a science. It's a lot of clinical trials been done last 10 years. So before that, it's only oral treatment. So as I said, we are pride that King's College Hospital London is one of the niche centers where we are the center of excellence for Parkinson's disease, where we started doing this advanced non-oral therapies. Again, I'm saying non-oral means nothing oral. We give the skin patch called dopamine patch. Now we get syrup, a dopamine syrup called amantadine syrup. So that means these are the easy ways for so many elderly patients which can easily absorb. Then we have a pen injection, like insulin injection. So, and we have a small tube. So we call it PPP, triple P therapy for Parkinson's. PPP for P, for Parkinson's. One is patch, Another one is pen, another one is pump.
I just
So
heard about that.
if you're giving oral tablets to Parkinson's patients over than a year, your brain gets sensitized and you get more side effects rather than efficacy. So my humble request to all practicing doctors is once the patient gets side effect with oral tablets, you should start looking into other non-oral therapies.
And that's what all you have done.
See, so that's what a lot of clinical trials. Now, if you ask me what else in the pipeline, we have an inhaler coming in, and we have a buckle, small sticker. We can keep it under the tongue. It's coming in, and also the gene therapies. We actually delivering the gene to strike to that area of the brain which controls Parkinson's. So let's pray that all treatments will have a huge success. Will become a boon for all Parkinson's patients.
Wow, that was a breakthrough. But are they clinically tested?
See, that's a clinical trials, we call it as. So we've got into 4 phases, phase 1, phase 2, phase 3. Phase 4 is the one which we can release it to market. So it's very promising, the phase 1, phase 3. So let's fingers crossed.
Finger crossed.
Thank you.
Right. So to be a warning for all of us and also the viewers, what are the early symptoms or the warning signs that we have to watch out?
That's a fantastic question. I just landed in Jakarta airport and waiting for my bags. I've seen 6 patients. One is shaking hands, one is shaking head, another one shaking legs. And also I've seen the proportion is one patient, the age of 29, a very young chap. And also there's another patient, 79. You can see the difference.
Yeah.
29 is having
79.
79. So Parkinson's is no more a age-related neurodegeneration. So there is some sort of a genetic susceptibility happening, especially in this Indonesian, Asian patients where they're getting Parkinson's at a very early age. So if you delay means defeat. So you shouldn't delay the progression of
You're
the
right.
disease. The early signs, number 1, if you lose your sense of smell.
No,
So
that's the first sign.
First sign, you're going to lose before the Parkinson's hits you badly. Say, number 1, if you lose sense of smell, we call it anosmia. I said, don't waste your time. You need to go and see a neurologist, your local neurologist. So number 1. Number 2, if your other half, like your partner, your wife or husband, tells you that you're pushing her in sleep, pulling her in sleep, shouting in sleep, we call it as RBD, ramp behavior disorder. That also will...
That's part of science.
Absolutely. And refractory constipation. For your, you're very young, I'm not that young, so if I lose
I'm not that young.
if you lose constipation, say if you're not opening your bowels for 3 days, that also is a red flag that you're starting Parkinson's. The reason for that is that dopamine, not only in the brain, you have dopamine in the stomach, dopamine in your eye, dopamine in your vocal cords. That's what Parkinson's patients can't speak out. Their voice is very low. So these are the red herrings that you need to, that predates Parkinson's. You know what I mean predates? Predates means if you have problems with the smell, if you have problems with sleep talking and sleep acting, and a refractory constipation, that means you'll get Parkinson's if left untreated. In next 2 to 3 years, it will hit you badly, where your whole body started shaking.
That's crazy. But we also like to know, why do people get Parkinson? I mean, like, is there any genetical factors?
See, number 1, as for now, iPhone 14, you're all waiting for iPhone 14, right? Yeah, the technology making us to live longer. The science making us live longer. So as you age, you have to age gracefully. So aging starts in your knee, arthritis. Aging starts in your skin, wrinkles. Same thing in the brain. If the aging starts, the dopamine tank reduces, you'll get a movement problem. However, 10 to 15% have genetic problems. So patients with genetic defects, they get Parkinson's at a very early age.
All right. So, but how can we prevent this disease?
Number 1, first of all, there is no question of you need to find out the early detection. Say, for example, genetic testing is very important. Say for any of your family member has a Parkinson's at a very young age, I would say that genetic testing is very phenomenal, paramount, so that we can start neuroprotection therapies. There are certain therapies where it stops progression of Parkinson's that we can start early to disease progression. And also you need to make sure that to avoid red flags like smell problems, constipation and sleep talking. So we need to wake up with these symptoms early.
Okay. I think it's going to be my last question.
Please.
Can a patient live a normal life with this Parkinson?
So I'll ask you a question in return. Diabetes patients, everyone has, like Asian population, all of us has diabetes.
Yeah.
Everyone has high blood pressure. Agree, yeah? Most of them say that. So as long as diabetes patients takes their insulin on time, blood pressure patients takes blood pressure tablets on time. Same thing with Parkinson's. If you diagnose this on the right time, right place, right treatment, and optimizing the treatment, you will live a normal life.
So I think that's all. Thank you so
very
much, Dr. Vinod
Sorry,
Mehta, neurologist and movement disorder specialist
Thank you.
London. Thank
Are
you
we
so much
ready?
for your time. Dan berikut tadi diskusi saya bersama dengan Dr. Vinod Mehta, seorang neurologis spesialis di London yang tentu saja semakin membukakan pandangan kita terhadap Parkinson dan apa saja yang bisa kita lakukan untuk mencegahnya. Saya Skolastika Silvia pamit, salam SCTV.